This is Dr. Sargisian, and we will talk today about fluids and electrolytes, acids and bases. To start this topic, I would like to touch base about the notion of total body water. You know from the literature and from colloquial evidence that a human body most of it is water. So when we're talking about total body water, we are considering that about 60% of the body weight in adult person is water. What that water comes from, it comes from some of all fluids within all body compartments that will be total body water. Common misconception, consider it intravascular water, intravascular fluid, which is not right. Again, it's the sum of fluids of all body compartment. So the volume of total body water is a percentage of body weight in kilograms. Just to touch base here, we all know that 1 kilogram is 2.2 pounds, and we will go again in this course by using kilograms. What's the rest of the body? What's the rest of the body weight? The rest of the body weight comes from fat-free solids, and when we say fat-free solids, we are not talking about yogurt, but we are talking about bone. What type of fluids we have in the body? Intracellular fluid, extracellular, and interstitial, which is also part of interstitial, is part of extracellular. Intravascular fluid, also different types of fluids such as lymph, synovial, biliary, hepatic, pancreatic, cerebrospinal, pericardial, peritoneal. You have your pleural space, pleural fluid, even the eyes, intraocular fluid. One of the most difficult concepts to master, but I'm sure we can do it in this course, that the fluid in intercellular spaces can be called interstitial spaces. So what's in that fluid? It's water, amino acids, some type of sugars, glucose, enzymes, hormones, neurotransmitters, salts, anything else like any cellular products, fatty acids. So these fluids surrounds the cells of the body, and this fluid is some type of communication channel. It's not really a channel like a network, but it's the surrounding gives you an option to deliver materials to the cell, and also important point again, your intracellular communication and removal of the waste. I'd like to talk in this course a lot about intracellular communication because again, human pathophysiology, we are talking about multicellular organisms, not unicellular. So again, one of the most difficult concepts is interstitial fluid, so-called third space. And this third space fluid allows means of communications and means of delivery of certain materials or compounds to the cells. And when you have delivery to some place, you also have waste removal. And by waste, we mean metabolic waste. Intravascular fluids or fluids within vascular space, and again intracellular fluid, it's completely opposite location. So you have this compartments of fluids, and the most distinct one is intracellular. Everything else is extracellular, which you can subdivide into third space or interstitial fluid, intravascular, and all small or relatively small compartments I was talking about, which located in their spaces, such as lymph node, such as lymphatic fluid, synovial, cerebrospinal, even sweat or urine still consider, if it's in the body, it's considered extracellular fluid. We know that it won't hang around there for good, for a long time, but it's still inside of the body. This is still extracellular fluid. Even fluid inside of the eyes, pericardial, pleural, peritoneal, all these types of fluids, it's all extracellular. So to distinguish, know the difference between intracellular and extracellular. Water moves between intracellular and extracellular fluids. So what happens here, we are again getting to the concept of semi-permeable membrane, which we all know from early childhood. At least some of us do, but most of us, we learned about this in physics courses, chemistry courses, and our nursing foundational courses, med-surg, and everywhere else. So we know about this. But what's the concept in this? What's the main thing to help you remember? You have to remember this: salt loves water, and this will help you a lot in your professional life. Salt loves water. Salty part will attract salty compartment, or compartment have a lot of solute, not solvent, solute will attract water into it. What's happening? Both compartments trying to equalize. So the concentrations try to get equal. Will it get equal or not? We don't know, and most of the time no. But salty compartment will try to draw the fluid into it. And by salty compartment, we're talking about solute. So example, you are giving hypertonic solution into your intravascular space, and hypertonic has lots of salt dissolved, so it will draw lots of water into it and dehydrate the cells. If you give hypertonic solution, you are putting your patient at risk of swelling of the cell, and swelling in the cells in the brain in particular, and everywhere else. So you can have hemolytic anemia by the means, not really an anemia, but you will have destruction of, or hemolysis of the red blood cells by them swelling with water, because concentration of salt or solute inside of the cell is much higher versus the concentration of the intravascular fluid per se. So they will burst. Same will happen with the brain. Besides of the bursting, the swelling itself in the brain will result in brainstem herniation. So please, I know this is review, and I know you all have knowledge of it, so please spread the word. Don't give anyone hypertonic solution unless it's indicated for one or the other reason. Hypertonic solutions are basically evil unless it's indicated for this person. So Starling hypothesis, or another way to put this is the Starling law, is describing the concept of net filtration. And net filtration, to understand this, net filtration means where the fluid will move and how much fluid will you have in that compartment. So net filtration equals forces favoring filtration minus forces opposing filtration. So this will show where the fluid will move. Starling hypothesis talking about net filtration. By forces favoring filtration, we will consider several forces such as capillary hydrostatic pressure, pressure in the pipe. You going home and opening your faucet and trying to cook dinner after a long day, and you are using hydrostatic pressure, basically pressure that tries to push water out of the pipe, or blood pressure in this case. Interstitial oncotic pressure is another force that favors filtration. What is interstitial oncotic pressure? It's the water pulling pressure. It's the water pulling force that encourages the water get into the compartment that is saltier, that has more solute. So from one side, your blood pressure will try to push out outside of capillaries your fluids, and on the other side, the saltiness of the, let's say, cells, or salt or solute concentration within the cells will aid by osmotic or oncotic pressure trying to pull more into the cells. Forces favoring reabsorption, it's plasma oncotic pressure. So we still have osmosis here, but we are concerned about the concentration of salt inside the vessel, inside of your intravascular space, and it will pull water in. Another one is interstitial hydrostatic pressure. Interstitial hydrostatic pressure is the same way like your pipes, like imagine your cell is a pipe, or whatever that surrounds the vessel or capillary is a pipe that tries to push the water in. So to summarize this, remember, hydrostatic pressure is the pressure of the pipe. It tries to push out the water because we pressurized it. Oncotic pressure is happening because of the concept or phenomenon of osmosis. The compartment of higher concentration of solute tries to pull the water into it, and even the concentration between two compartments. The key point, the cornerstone here, again, the compartments are divided by semi-permeable membrane. Semi-permeable membrane means that your membrane is selectively permeable. In this case means the small particles like water molecules will pass through, but larger particles they won't, such as big proteins or dissolved salts and electrolytes, that type of things. But again, large particles have misfortune of staying in their compartment, while water can pass back and forth and create the oncotic pressure. Accumulation of the fluid in interstitial spaces can be extremely dangerous, and what I'm talking about, of course, is edema. What can cause it? So first of all, think about increase about hydrostatic pressure. That can definitely increase the accumulation of the fluid in interstitial space, and by hydrostatic pressure I mean in the capillaries. Your capillaries are overfilled and trying to give out as much water as they can. Okay. Well, what about oncotic pressure? We remember from the previous material that your intravascular fluid has oncotic pressure, of course, and oncotic pressure of intravascular fluid is the force that goes from outside of the vessel towards the inside of the vessel. What's inside of the vessel? Okay, we know that salts are dissolved, but here we're coming to this most important concept of albumin. Albumin produced by liver, one of the proteins. Albumin can signify the liver dysfunction, and at this point, when we have diminished or no production or even destruction of albumin, the edema may occur. Without albumin, your capillary space does not have enough force, oncotic pressure, to pull the water out of the cells. So that's why they would go, or interstitial spaces in this case, that's why they would go out of the vessels and lodge somewhere. And yes, edema is accumulation in interstitial spaces, and yes, low albumin will cause this. Low albumin will cause swelling and edema. That's why your patients with liver failure always, well, not always, but very often may have lower extremity edema or even generalized edema. Another type of edema is lymphedema, when lymphatic network gets obstructed and there is no way to drain out lymphatic fuel. There is no way to drain out lymphatic fluid. Lymphatic obstruction causes the lymphedema, and the examples are some type of surgery, manipulation with lymphatic vessels, nodes, and this all can cause lymphedema. The last one I want to mention is your capillary permeability is increased, so fluids just spill out of the capillaries. This works in conjunction with hydrostatic pressure, but what happens if capillary permeability is increased, you don't need significant hydrostatic pressure to push the fluid out of the vessel to interstitial place. So this means that your hydrostatic pressure may be fairly normal, but if your capillaries are very permeable, that means even normal pressure will create edema.